listeners. My name is Claudia.
And my name is
Yeah.
Anna.
Welcome to the first and last episode of this podcast called If Who Won't Sponsor Sari Filtration, Who Will? In this episode, we will discuss a case study that assessed the effects of Sari filtration in a town in Bangladesh titled Simple Sari Cloth Filtration of Water is Sustainable and Continues to Protect Villagers from Cholera in Matlab, Bangladesh by Anwar et al. For context, Sari filtration is a prevention method against cholera. We have Dr. Sapkota from UMD School of Public Health here to give us more insight on what cholera is and how Sari filtration proved to be effective in reducing its incidence.
We would like to focus on the effects of cholera on health, specifically, mostly discussed diarrheal cholera. Children under the age of 5 in underdeveloped and developing regions are significantly more susceptible to contracting cholera and other diarrheal diseases. In fact, diarrheal diseases are one of the leading contributors to under 5 mortality in low-income countries.
To add on to that, here is a short excerpt from the interview with Dr. Sapkota explaining the local stance on the issue.
Sure. How do community members view the cholera problem and its rapid spread?
Sure. I think, and this is just from my perspective, because I've not done research in Bangladesh, but just from what I've read, people know that this is a problem. It's critically important, particularly if you're a parent who is at risk of losing a child because of cholera infection. But I think the knowledge of why the infection is happening and what the transmission routes are may not be as widely known. This may sort of vary from village to village. Some villages may have a very good sense of how the disease is occurring and therefore how they could potentially stop transmission, and others may not have that education.
A simple method for water filtration was introduced in Matlab, Bangladesh, and was tested to see if it is effective against the likes of cholera and other waterborne diseases. In order to evaluate the effectiveness of Sari cloth filtration, a field trial was conducted. In the village of Matlab, Bangladesh, women were held accountable for collecting water from local ponds and rivers. 15,000 women were given cotton sari cloths, while another 15,000 women received nylon mesh to filter their water. The control group consisted of 15,000 villagers who were not given any instruction on anything with respect to water filtration. The field trial displayed results of cholera cases being reduced roughly 50% for the group that used cotton sari cloth as their form of filtration, while the group that used nylon filtration showed to have been slightly less effective. Additionally, nylon cloth was much more expensive than sari cloth. A 5-year follow-up was conducted, and it concluded that the method was not only accepted by the villagers, but also proven to be very effective in filtering water.
Now we're going to focus on some of the pros and cons of the intervention. And one of the pros of this intervention is that the required materials, so the saris, are readily available as they're a pretty commonly worn garment in this community. Another pro is that using saris to filter out unwanted insects is a pretty common practice, which means there's a higher probability that community members will accept sari filtration. On the other hand, some of the cons of this intervention is that a behavioral change is required, and Dr. Sapkota will touch more on why this is a difficult thing for public health officials. Another issue is that proper cleaning of the sari after using it for filtration is required, and this is an additional step that takes more time and effort, and if this isn't done, then future filtrations using a dirty sari will not be as effective. Lack of public awareness and knowledge of how cholera is transmitted is another issue. And a lack of public knowledge of the benefits of using sari filtration is another issue as well. And lastly, the last con of this intervention is that community members might not know how to fold the sari and how exactly to use their saris to filter their water.
As Claudia stated earlier, here is the rest of the interview that we recorded with Dr. Sapkota.
How might community and cultural beliefs impede community members from accepting Sari filtration as an effective, safe practice for their families?
Mhm. So, well, first, on the one hand, let's talk about first why they might accept the use. So, a lot of times, and I think that Anwar Huck has mentioned this in some of the interviews that he's given, that using a folded sari to filter out, insects or other dirt particles from beverages is, a relatively common practice. So, this is not an entirely new concept to use a folded sari to filter out, an unwanted contaminant. So, this is one reason why it could be accepted. Uh, One barrier to use could be uh, people aren't sure of exactly how they could fold the sari, and also potentially a lack of understanding of the benefit of taking this extra time while you're going and gathering water. If people don't really understand the value of that, again, getting back to education and outreach related issues, then they may be less likely to take that extra step and extra time and work to proceed with some sort of filtration of their water.
I know you just mentioned how, like, them not understanding the importance of it could have a, like, great impact on if they use it or not, but, are there any other difficulties that, you believe public health officials might face when promoting sorry cloth filtration to community members, or do you think that's, like, the overarching issue?
Sure. Well, I think if you look about public health interventions broadly, uh, it's difficult when you have an intervention that is based on a behavior change. It's very difficult to change people's behaviors. Uh, so, because this intervention is relying on people to change their behavior and then continue to promote that learned new behavior, this is where things can get tricky. This is why typically when you talk about a public health intervention, it's better if you can have an intervention that is not reliant on someone's behavior change.
In addition to the fact that it requires a behavior change, and as you discussed, that's very difficult to accomplish, do you think there are any other limitations to Sari filtration, whether that be like other issues that public health officials might face, or just in general how effective Sari filtration can be?
Sure. Well, I mean, if you think about it this way, once you've used the folded sari to filter the water, you then have to clean that sari and dry it out in the sun. So that's sort of another added step, another, uh, I guess, element of time or work that would be required to complete this type of water treatment or intervention. So I think that that could also be another potential barrier, that it's an even an additional time uh, or work that must be put towards you know really doing this sorry filtration in a good way, because it's not just about filtering the water initially, but then, as I said, you have to make sure that that sorry is then cleaned properly and dried before you use it again.
In what ways can potential moral and ethical issues in this intervention be addressed?
Were there any specific moral or ethical issues that you had come across in your research?
I can kind of speak on that. We really didn't find that many, but one issue that we did find was that a few families wanted to withdraw from the study because they were part of the control group. And the way they kind of viewed it was that they were putting their families and their kids, especially, at risk for being in that control group and not using Sari filtration.
Mhm.
And we thought this kind of implied that a lot, maybe more participants didn't really have a full understanding of what the study was doing and kind of all of its implications.
Mhm.
So that was like a potential issue that we found, and we were wondering if you could like
Sure.
speak on that.
Yeah. So I think, and that's getting at, I don't know if there are necessarily moral and ethical issues about the intervention itself. You might be getting at the moral and ethical issues of the study design itself, and how they separated into a control group and an intervention group. So to avoid these issues, and I did read that in the case study as well, because of course, if someone is really fully understanding that this could really reduce your risk of cholera, and particularly among children, young children, could reduce their risk of death, you're going to want to use the intervention. You're not going to want to use to not be part of the intervention group. So one way to change the study design so that you would avoid having a control group that did not have the intervention is it would be a study design where let's say you go into the village over a certain period of time and observe the rates of cholera over the first 6 months. And then after 6 months of observing uh, what sort of this baseline rates of cholera are across different age groups, you then give your intervention to the entire community and then study over time how do those rates then in the entire community compare after everybody has had the intervention. Uh, so the case then, in theory, or the community is serving as its own control. And that's something that you'll often see in studies where the intervention is so beneficial that it really doesn't seem ethical or morally right to withhold the intervention from a control group in that case.
That definitely makes a lot of sense. I had never even considered using like the baseline rates as a control. That's very interesting.
Mhm.
Um, Another question we had was actually about something that you discussed in your guest lecture in our family science class with Dr. Maring last semester. So you had discussed how the World Health Organization wasn't promoting sorry cloth filtration, and we were wondering, like in your opinion, why do you think that is that the World Health Organization is like not promoting it?
Sure. And there's probably a couple, well, this is a very complex issue, and it's probably there's a lot of different factors as to why the World Health Organization is not actively promoting Sari filtration. Uh, and instead, really right now, they're pushing vaccination. So it goes back to a little bit of what we talked about before, where ideally for a public health intervention, you don't want to have to rely on a behavior change. So with a vaccination, there are separate set of issues of actually trying to get shots in arms, as we're seeing with the current COVID pandemic. But at least with vaccination, you give someone a shot, they get the shot, and they don't have to do any other behavioral change. In theory, if you have a highly effective vaccine, that person would be protective. Although I think in the case of the latest oral cholera vaccine, I think the effectiveness is about 50%. So you're at about the same efficacy in terms of reducing diarrheal illness as you are with the Sari filtration. So it doesn't really do a much better job, but it's still getting you away from that behavioral change. So that's one very valid reason why public health agencies like the World Health Organization might not want to support or would rather support a vaccination campaign that doesn't rely on behavioral change versus a Sari filtration campaign that does rely on behavioral change. But there's also been some other articles written about this where there's also a question of, on the one hand, the big positive about a Sari filtration campaign is it doesn't cost the individual anything. They already have plenty of old Saris within reach, and they just need to incorporate that in a water filtration setup. And so this is beneficial to the community because they don't have to spend anything. But no pharmaceutical company, no outside agency can then profit from that intervention. So nobody's making a buck here if Sari filtration is supported and by public health agencies, for example. So that is a little bit of a cynical way that idea that has been brought up as to why influential agency like the World Health Organization might not be supporting this type of Sari filtration method.
So we talk about behavioral change a lot and how that's like one of the big issues with Sari filtration, how like it requires us for the community to have a whole behavioral change. I was wondering if you know of any like ways that behavioral changes have been able to actually like have an effect on a community and like actually be successful, if that makes sense.
hmm Well, I mean, so even though we've been sort of knocking behavioral change related interventions. At the same time, you can see that, in their initial study of the effectiveness of Sari filtration, they saw a 50% reduction in diarrheal disease. So that's an incredible reduction. And then when they went back 5 years later, they saw that, while not everybody who initially was using the Sari filtration in their first study was still using it, there was still significant amounts of Sari filtration use and significant reductions in diarrheal disease. So uh, it did work, even though it was relying on behavioral change. But I think what potentially works best is if you take more of what we call a systems-based approach to solving a problem. So you're looking at sort of the entire problem. So, and here with cholera, there's many aspects of the problem. First of all, you have contaminated water because people are and this is often happening because people are open defecating, or because their sanitation system where they are defecating is not properly distanced from their water source. So that's one of the problems. Another problem is that there's not enough knowledge about that link between contaminated water and diarrheal disease. A lot of people don't understand that drinking dirty water can actually result in a diarrheal disease. So there's like an education gap as well. And then there's also, similarly, people don't understand the importance of hand washing and how critically important it is to hand wash, after you go to the bathroom, before you're preparing meals. So if you want to take a look at all of those issues, you would want to have sort of a more holistic intervention. So you might want to bring in your Sari filtration method combined with a hand washing campaign, combined with an improved sanitation campaign, where perhaps if people do have access to improved sanitation like latrines, perhaps those latrines can be better placed further away from the water source, so that you're doing what we call source water protection and trying to prevent the water source from becoming contaminated in the first place. So I hope that answers your question, that, so moving towards, instead of just focus on one specific intervention, looking at a more holistic intervention that can touch on all aspects of the issue to get overall better declines in diarrheal disease.
Kind of going off of that, based on like the study's findings and your professional opinion on ways we could like improve the intervention, do you believe that Sari filtration could become a widespread method for preventing the transmission of cholera? And could it become like an effective long-term solution, or is it more of a temporary solution, which, like you mentioned, requires a better method?
Mm-hmm. I think that it's an excellent part of a broader holistic solution. You know, obviously, World Health Organization is still supporting the use of vaccination, but we know that vaccination can't reach everybody, and there are equity issues here too. So that perhaps some of the poorer villages that are located further out are not gaining enough access to the vaccine. So in that case, using this simple, low-cost method is an excellent part of a broader solution. But as I was mentioning earlier, I think that should also be accompanied by more education outreach regarding the importance of hand washing and the importance of keeping your sanitation facilities separate from your water facilities. But I think one important thing to keep in mind, though, is when you're talking about long-term sustainability, you really have to have this holistic solution be a community-driven, stakeholder-driven solution. You need to have leadership from within the community to actually make a solution last and be sustainable over time. If you haven't, this is an incredible example of a study. This was a University of Maryland research team that had this great idea, brought it to communities in Bangladesh. But then the next step is, okay, well, how do we have better buy-in from within the community to keep on emphasizing, on daily, weekly, monthly basis, it becomes part of the culture of that community that this is important. I think one thing the researchers mentioned in their article is that one of the reasons why, when they came back 5 years later and they saw sort of lower compliance with the filtration method, it was because there was a lack of sort of continued enforcement and continued discussion about the importance of this. So again, you really need to have a solution from within the community for it to actually be sustainable over time.
I think that definitely makes sense, and it kind of ties into what we've been discussing in our scholars class, where we're talking about key stakeholders in certain interventions, and this is one where the community members are one of the main key stakeholders, and how important it is to engage community members and also have a culturally competent approach to the situation. So that's a very interesting point. Those are pretty much all of our questions, but are there any other comments you would like to make?
Uh, I really don't have any other additional comments, just that I think you guys have chosen an excellent case study. Cholera is one of the most important infectious disease challenges in many parts of developing countries. So bravo for choosing such an important concept and learning more about it.
Thank you so much, and thank you for taking the time to join us today.
My pleasure. Take care.
Bye-bye.
Bye-bye.
In conclusion, Sari Filtration, specifically those which used 4 layers of Sari cloth, showed to be effective in reducing hospitalization for cholera and diarrheal diseases. This, however, is not a long-term solution.
Larger interventions are necessary, but this poses as a great starting point to combat cholera, which is putting populations continuously at risk. Other systematic issues, such as inadequate water supplies and lack of sanitation in underdeveloped regions, must be addressed in order to resolve this global public health problem.
This marks the official end of our podcast. Thanks for listening.